Hello, my name is Dr. Joan Carlini and I'm a researcher and health consumer. Today we're talking about accepting help and I have two very special guests. I have Julia. Julia is a brain cancer survivor. Welcome.
Thank you.
And I have Catherine. Catherine is a carer of a person with brain cancer. Catherine, can you please tell us a little bit about when your husband was first diagnosed?
So my husband was diagnosed with brain cancer nearly 10 years ago. He was diagnosed following a seizure at Chermside Shopping Centre. He was taken to the Royal Brisbane, had another seizure where a tumour was discovered. He had surgery which then led on to chemotherapy, which led us to being in this world of brain cancer. Obviously from there we ended into a whole new life and where we needed to start getting help.
Exactly what help did you need in those very early days?
So in the very early days we started needing help and having to wanting help from personal help from family and friends. Mm-hmm. So that and also work colleagues and things like that. It's difficult to know in the first stages what sort of help you're going to need. Because you're in such a whole new world of medical appointments and doctors and things like that, it's really difficult to focus. You get into survival mode, everything's a whole new experience and you're really not sure from minute to minute and day to day what's really happening, and you're trying to just function as best as you can. You do get, and people are wonderful, they say to you, you know, let us know what you need, but you really don't know what you need until it's right on top of you. And so for us it was really difficult for me and as the carer to articulate what we wanted. What was wonderful was when someone took that thought process from us and did that for us. So for example, if someone like the school mums went and got groceries for us, and I needed to still get my daughter to school and back and still had to be a mum, so she still needed school lunches. You know, we still needed to have toothpaste and toilet rolls and the general groceries day to day. So they went and did that for us. They went and got groceries and made sure that I didn't need to go running to the supermarket after a day of hospital appointments and things like that. So having someone who was able to take that out of our hands was just wonderful and made such a valuable difference.
Julia, at that early stage you were actually the patient. Did you experience needing help, or was that something that your husband or the carer took over, or what was your experience?
We had 4 small children when I was first diagnosed, so life was pretty chaotic. For me it was very difficult because I couldn't do anything to help. I also didn't want to ask for help because it was embarrassing. And my husband didn't really want to ask for help either because he was trying to be, you know, the big strong husband who was looking after everything. But we did have people who would just say, if anybody wants to help, point them at me and I'll find things for them to do. Because there are things like, you know, my husband needed shirts to be ironed for work and I couldn't do it, but it's not something you're thinking about when you're having treatments and going for scans and doing the whole medical thing. It's not at the forefront of your mind. So having somebody else to advocate and organise those kinds of things for you is really helpful.
How did that person step forward with that role?
It was a friend of mine who's really quite pushy and bossy, which is handy because she saw that there was a problem there. You know, I was trying to get the kids to school and I couldn't get out of bed. and she had a child of a similar age, so she sort of knew that the kids needed to get to school, they needed lunches, they needed bits and pieces. So she just went, okay, you know, I'll take care of this, I'll get people to do things, you just do what you have to do.
Get well.
Yeah.
And so, Catherine, so after that initial period of getting that bit of personal help and getting those groceries, what happened next? What was the next stage?
So that personal help is so important in those initial stages, but once you've sort of got into that sort of 6-month stage and things have started to settle down and you're not quite so raw, then it's really quite valuable if you can, or we found it valuable if you can touch into sort of more of a professional type services. So things like the Cancer Council, the Brain Tumour Alliance of Australia, things like that. They became really important. So my husband got huge support from tapping into things like the Brain Tumour Support Group that is run by the Cancer Council. The Brain Tumour Alliance of Australia were incredibly wonderful for us for sources of information and other sources of support. They ran wonderful forums and things that we could go to meet with other brain tumour families that were going through things like we were going through, and we're able to provide that more sort of professional type support. Things like GPs as well, who were able to provide things like access to psychology appointments and other more sort of professional types of support to sort of bolster the support we were also getting from family and friends. Became important as an additional layer of support.
Sure. Julia, is that something you did as well? Like, were you receiving support as the patient and was your husband receiving support as the carer?
I think that in my experience, people tend to focus on the patient and not the carer.
Right.
So everybody's worried about the patient. Are you going to be okay? What do you need? But they don't really look at the partner or the children or the rest of the family who are living with this as well. So it can be really difficult for carers to be able to access help when it's all primary aim at patients.
Yeah, so Catherine, with that in mind, it sounds like you may be able to ask for help for your husband and your family, but were you able to ask for help for things that you needed?
Look, I would agree with Julia. It was really common, you know, people would come to me and say, how's your husband, how are your children? But it was very rare that people would come to me and say, how are you going? And it can be lonely being a carer. And it's really important, and I didn't do this very well at all. And I ended up, you know, having to go to the GP and ask for care for myself. Sure. Because it becomes you've got to look after yourself as well as a carer, because if you don't look after yourself, then you can't look after the patient.
Sure. I'll just wrap up now. Thank you both for coming in and sharing your very personal stories. So in conclusion, the first part is the early stages is to take care of the family, and later on to seek support from professional groups and the GP, and make sure you're taking care of yourself.